hello everybody, welcome to my YouTube channel. Welcome to Healthy Lifestyle Matters. Indeed, Healthy Lifestyle Matters. Yeah, I encourage you to be your own doctor. So how do you be your own doctor? By living the healthiest life possible. Thank you for watching the video. Thank you for tuning in. So for those who don't know me, my name is Stephanie Agbonkwa, but I'm popularly known as Daughter of Zion. Thank you for tuning in. So without wasting much time, we're going to dive into what brought us here today. So today we are here to talk about another healthy ways to live a healthy lifestyle. How? Okay, now we're going to be talking about blocked fallopian tubes. Okay, y'all, we're going to start by defining what a fallopian tube is, and then we go further to touch what blocked fallopian tube is, and then we're going to talk about the causes of blocked fallopian tubes, and of course we're going to ask we're going to do a Q&A for some questions that might arise, and also we're going to go further to talk about how blocked fallopian tubes can be diagnosed, and of course the last point we're going to touch today is remedies of blocked fallopian tubes. So without wasting much time, let's dive into the definition of what fallopian tube is. So fallopian tube is a pair of tubes along which eggs travel from the ovaries to the ovaries in order for fertilization to take place. I'll repeat again. Fallopian tubes is a pair of tubes that along which eggs travel from the ovaries to the ovaries so that fertilization can occur. And so what we mean by blocked fallopian tube is any obstruction or any hindrance or anything blocking the pathway along which eggs travel from the ovaries to the ovaries. Any blockage, any hindrance, any obstruction along the way that causes eggs not to travel from the ovaries to the uterus is what we call blocked fallopian tubes. So before going into the causes, I would just want to let you know that this is a very serious case. As a matter of fact, it is a very serious case because it is accountable for 40% of females being infertile, their inability to produce children. So when your fallopian tube is blocked, there are certain ways, or there are certain diagnosis, or there are certain treatment that you have to undergo. If not, the chances of you giving birth is very, very little. So this is a very serious case, and I want you to watch this video and share this video to as many people as you can. So talking about fallopian tube, blocked fallopian tubes, we all know that fallopian tube by definition is a pair of tubes along which eggs travel from the ovaries to the uterus. And then when we talk about blocked fallopian tubes, we're talking about any hindrance or any obstruction, anything standing on the pathway which eggs leave the ovaries to the uterus in order for fertilization to occur. Anything obstructing eggs from leaving the ovaries to the uterus is what we call a blocked fallopian tubes. And please, don't be ashamed, don't be scared if you know you are going through this. You just have to make sure you're doing the right thing by talking to your doctor if you have any signs and symptoms, because of course I'm going to release some signs and symptoms of blocked fallopian tubes. So without saying much about the definition of fallopian tubes and then also the definition of a blocked fallopian tubes, let's talk about causes. What is going to cause you to have a blocked fallopian tubes? We have pelvic inflammatory diseases can cause you to have a blocked fallopian tubes by because it can obviously cause scarring, which is gonna be like a blockage that eggs cannot travel along the ovaries to the uterus. We also have ectopic pregnancy. Ectopic pregnancy is a condition in which eggs are being implanted outside of the uterus. So eggs are being implanted outside of the uterus. So that's what is called ectopic pregnancy. Another cause of blocked fallopian tube is previous or frequent abortions. Believe it or not, previous or frequent abortion can cause you to have a blocked fallopian tubes. We also have sexually transmitted diseases such as chlamydia, gonorrhea. Those can cause you to have a blocked fallopian tubes. And not forgetting tuberculosis. Yes, you heard me. Tuberculosis can cause you to have a blocked fallopian tube. We also have a congenital tubal obstruction that is from birth. There are some birth defects, or especially babies being born prematurely, that can cause a blockage of the fallopian tube. Congenital tubal obstruction can be another cause. We also have, of course, fibroids. You heard me. Fibroid, of course, fibroid can cause you to have a blockage in your fallopian tube, because of course the growth can hindrance sperms to reach the eggs, and that can be a possible cause of blocked fallopian tubes. What else do we have? We also have medical conditions such as HIV. Believe it or not, HIV, chlamydia, gonorrhea, tuberculosis can also be another cause of blocked fallopian tubes. Also, I did mention of ectopic pregnancy, and then we also have if you have once have a surgery, if you have once had surgery along your fallopian tubes, that can be a cause or a hindrance or an obstruction that can cause you to have a blocked fallopian tubes. Also, we also have endometriosis and adhesion, that of course the tissue can build up, and of course it's gonna be a hindrance or an obstruction to a fallopian tube. So these are some of the causes I didn't mention, or because of the sake of time, these are some of the causes of blocked fallopian tubes. One of it, which is abortion. So if you previously had abortion, especially abortion not done the right way, if you previously have abortion, medical condition like HIV/AIDS, and then and things of that nature, you want to find out, because those can be a possible cause for blocked fallopian tubes. And you want to really know what's funny? A lot of women don't know they have a blocked fallopian tubes until it becomes the extent that maybe they're trying to get pregnant or trying to have a baby, and in the course of trying to have a baby, they realize that they can't, and they'll obviously go to the hospital to do medical checkup. That is when they'll realize that there's a blockage in their fallopian tubes. A lot of women, because the signs vary, some people don't even have any signs. That's what is more funny about. The funny thing about it is that some people don't even have any signs of blocked fallopian tubes, and in the course of trying to get pregnant, that is when they realize that their fallopian tube is blocked. That is why they are not able to get pregnant. That is when they know that they have a blocked fallopian tubes. So like I said, don't feel ashamed if you know you are a victim of this. You just have to seek medical advice. So now let's talk about signs and symptoms of blocked fallopian tubes. Let me just say this thing. Fallopian tubes, we all know that there are two of them, right? There's one and there's another one. There are two of them, one on the right, one on the left. So there are two of them. So when we talk about the blocked fallopian tubes, it can occur in either one or both of them. There are two holding the eggs together. So when we talk about blocked fallopian tubes, it can be one or it can be two. So you want to find out which of them, is it one that is affected or two that has a blockage. So now let's talk about the signs and symptoms of blocked fallopian tubes. Like I said, some people don't experience any signs. So the fact that you don't experience any sign doesn't mean you have a blocked fallopian tubes. And the fact that you experience this sign does not definitely mean these signs are for blocked fallopian tubes. Like I said, signs and symptoms come out there to tell you that something is not right, and until you go to your doctor, you wouldn't know what is not right or what is supposed to be, what is not. So signs and symptoms of blocked fallopian tubes, of course, serious or chronic or acute pelvic pain during sexual intercourse. We have high temperature, but temperature of over 101. This is acute cases. And then we also have back pain. There are some people that give them back pain. And then we also have nausea and vomiting to some people, especially when it's acute. So you want to find out. And then we also have some people start vomiting. Some people pain during sexual intercourse, pelvic pain, nerves pain, and stuff like that. So those are some of the signs and symptoms of blocked fallopian tube. Like I said, the fact that you're having a back pain, a pelvic pain, pain during sexual intercourse or something of that nature, vomiting, nausea, high temperature, doesn't necessarily mean you're going through blocked fallopian tubes. you just need to go to your doctor and then they will run some tests before you know that, okay, this is what is going on with you. Don't just conclude that, okay. So before I go into the treatment of blocked fallopian tubes, I just want to answer some questions that was in my inbox concerning this topic. So the question goes like this: can a woman with blocked fallopian tubes get pregnant? So this is what happened. The question is like this: can a woman with blocked fallopian tubes get pregnant? So this is the thing. If the fallopian tubes, we're talking about the two tubes, if the fallopian tubes is totally blocked, it is impossible to get pregnant without treatment. Can I repeat that again? So the question is, can the woman with blocked fallopian tube get pregnant? So this is the answer. If the fallopian tubes, the two of them, is totally blocked, it is very, very impossible for that woman to get pregnant without treatment, which means she has to undergo treatment. I don't know if it's surgery or whatever, due to what she will be diagnosed of. And if it is, by the grace of God, she can get pregnant. But like I said, if both tubes are totally blocked, it is impossible for that woman to get pregnant without treatment. But if the tubes are partially blocked, there is a possibility of her getting pregnant. But the risk of ectopic pregnancy is very, very high, because it is difficult for because it is difficult for sperms to pass through an obstruction in order to get into the uterus in order for fertilization to occur. What am I saying? The question of can a woman get pregnant with a blocked fallopian tube, there are two ways. If the fallopian tube is totally blocked, it is impossible for her to get pregnant without treatment. But if the fallopian tubes are partially blocked, she can still get pregnant, but the risk of ectopic pregnancy, that is pregnancy implants or eggs implants out of the, or fetus implants out of the ovaries, is very high. So she can get pregnant with partially blocked fallopian tubes, but the risk of ectopic pregnancy is very, very high, because it is difficult for sperms to live and travel through a hindrance or an obstruction to go into the ovaries where fertilization occurs. So did I answer that question? Yes. So the next question that I have is how fallopian tubes blockage can be diagnosed. The question goes like this: can blocked fallopian tubes be diagnosed? Of course. Yes, blocked fallopian tubes can be diagnosed. It is diagnosed with a specialized X-ray. The specialized X-ray is called histopterossal pygogram, where this is a situation where they install dye, DYE, into your cervix. And what the dye does is this. Yeah, so they will place a dye into your cervix. They will place a dye. Yes, that's what the question I'm answering. Yes, blocked fallopian tubes can be diagnosed. Blocked fallopian tubes can be diagnosed with a special X-ray. The special X-ray is called histopterossal pygogram. This is a condition where they will take that DYE and they will place it or install it into your cervix. And when they install it into your cervix, they will be taking X-ray pictures. And if the dye is able to go through, it means you don't have a blockage. But if the dye that is being installed into your cervix is unable to go through, then there's a possibility that you have a blockage or an obstruction or something hindering the entry of that dye into your cervix. So if the dye is able to go through, it means you don't have a blockage. But if the dye is unable to go through, it means there is a blockage, an obstruction, or a hindrance. So that is how blocked fallopian tube is being diagnosed. So talking about treatment of blocked fallopian tubes. So like I said, you wouldn't know if you don't go check out. So treatment of blocked fallopian tubes. If the tube is, totally blocked, like I did mention, it is impossible. But if it is partially blocked, then there's a possibility. So if the tubes are blocked by a small amount of scarring tissue, Then laparoscopy surgery is recommended, as it will help to open the tubes and also to check the patency of the tubes. But if it is totally blocked, like I said, this is when it is partially blocked. But if it is totally blocked, it is very, very impossible. You just have to proceed, or it is advisable with that, diagnostics, it is advisable for you to go through IVF technology, because like I said, when it's partially blocked, we have more chances. But when it's totally blocked, especially the two pairs, then you just have to proceed with IVF recommendation, because of course that's gonna be the best for you. Yeah, I did answer the question of can a blocked fallopian tubes, can a woman with a blocked fallopian tubes get pregnant? Yes, depending on what I said, if it's totally blocked or partially blocked. And I did answer, I think, all the question that is in my inbox. Okay, so I pretty much, that's what I have for you guys today. Please, if you haven't subscribed to my channel, please subscribe to my channel, turn on your notification bell, and share this video. It might help somebody to get along it. And don't forget to subscribe, turn on your notification bell. If you do have any questions or any concern, or probably I didn't answer your question, please leave it in the comment section below and I'll get to it as soon as possible. Thank you for watching. I appreciate you. Thank you for 1.050 subscribers. I really do appreciate it. Thank you. I'll see you guys in the next video.